Welcome to another Doctors Express Medical Minute.
Hi, I'm Dr. Thomas Brown. I'm the Medical Director for Doctors Express of Danbury. Unfortunately, we've had a recent outbreak of measles in New York City and more locally in Fairfield County. We thought in about 2000 that measles had been eradicated in the United States, but partly because there's been an influx of folks from other countries who presumably were infected, and partly because unfortunately not everyone gets the MMR, the measles, mumps, or rubella vaccine. For various reasons, the disease has reemerged. So with any luck, this reemergence of the disease will prompt folks to explore getting vaccinated once again with the MMR vaccine. So what again is measles? Measles is a virus. It's very contagious. It's spread through the air in direct contact, and it causes a viral syndrome. So like most viral infections, people can have a fever, they can have a rash, they can have a runny nose, red eyes, and fatigue. And people can be contagious with measles for up to 4 days before the actual rash comes out, and for a good 3 or 4 days after the rash is present. So they can be contagious before the rash actually is present, before they even know that they might have measles. Most of the time, a measles infection is fairly self-limited, like most viral infections. However, there are a subgroup of people who are susceptible to some fairly serious complications. Pregnant women who are not immune, who haven't received the vaccine, immunocompromised patients, people receiving chemotherapy, for example, or have weak immune systems, and infants less than 1 year of age. They can be susceptible to these complications, which can include even death. Pneumonia requiring hospitalization can include brain damage, and can include miscarriages. So it's important that people are aware of these potential complications. It's important that people are aware of their vaccination status. They should go to their doctor, or of course here at Doctors Express we're happy to review your immunization records and determine if you are immune. We can do blood tests. Again, the MMR, measles, mumps, rubella vaccine, is the one that is required. We like to give 2 vaccines, one before the age of 12 months and another at 4 to 6 years of age. But you can get the second one as an adult, and then you need a follow-up blood test just to ensure immunity. So if you feel any of these symptoms, you have a fever, you have a rash, you have a runny nose, red eyes, obviously lots of different viruses can do this, but we have to be aware of the recent measles outbreak. What I want you to do is see your physician or come to Doctors Express, be seen by a professional, and if possible, bring your vaccination records so that the physician can review them.
This has been another Medical Minute presented by Doctors Express Bridgeport. Visit our website, www.doctorsexpressbridgeport.com, and like us on Facebook at facebook.com/Doctors Express Bridgeport.